Hi, everybody. My name is Dr. Robi Tamargo, and I've been encouraged by my daughter Riley to provide an update on my health status in an effort to help inform my friends and family, as well as physicians out there who might see this, about the dangers of becoming a COVID long hauler. I want you to know that 20% of 18 to 34-year-olds and 35% of people 35 and older get the long haul version of the disease, and no one knows what severity that you're going to get. So I hope that my update will be helpful to you. So I want to remind everyone that day 1 of my symptoms was May 7th, 2020, when I awakened 2.5 hours late for work with a hoarse voice, sore throat, dry cough, upper chest pressure, severe headache, fatigue, and no appetite. Later in that day, about 3 o'clock, the left side of my face became numb, and I was admitted to Mayo Clinic Hospital for the suspicion of a stroke. I ultimately was diagnosed with having a TIA. Fortunately, they were able to administer an IV and heparin, and that prevented me from having a full stroke. So that was really, really very fortunate for me. Then on day 4, I developed the fever and diarrhea. Day 6, I developed conjunctivitis in my right eye, and my eyes have been painful and blurry. My vision has been blurry ever since. On day 8, I developed chills, and I was finally seen at the Mayo Clinic COVID clinic and was diagnosed as clinically positive for COVID-19. On day 15, I developed myalgia in the right side of my neck and my left deltoid, and nausea. Then on day 17, I developed lightheadedness, hand tremors, myalgia in my entire upper back and my whole left arm. And then on day 23, I started to have improvement in my cough, and the hoarseness changed from being this really deep male voice to something that sounds more like this. And then on day 27, which was June 2nd, I had a stabbing pain in my right foot in one bulging blood vessel, and pinpoint pain that lasted for 7 hours. And then after that stopped, within the hour, all 10 of my toes started itching and were in searing, burning pain, which lasted for 4 hours. My feet were purple and red, and I was ultimately diagnosed as having what's referred to as COVID toes, which is due to microclotting, according to my awesome neurologist, Dr. Assad. On Monday, June 8th through June 11th, I had a normal voice. My cough was much lighter. All my symptoms were still present, but were less. But I had a normal voice. I sounded like my normal self for 4 days. Then about 10 o'clock that night on Thursday, the 11th, I spiked a fever, 101.3, I believe. And the next morning, I awakened with the hoarse voice again. And that late morning, early afternoon, about noonish, I developed sudden shortness of breath and severe, really extreme pain in my back rib cage, that then the pain came around the side to not quite to my sternum, but right in the middle of my chest. And whenever I took a breath, the pain was extreme and severe. So I had to breathe diaphragmatically in order to breathe at all. And I went to the emergency room where I was treated with morphine and had a chest x-ray, which did not show pneumonia. And I had a chest CT, which did not show a pulmonary embolism, which was the fear. They kept me about 7 hours and then sent me home with a narcotic cough medication and told me to follow up the next day with my primary care if I didn't feel better. So the next day, which was a Saturday, I wasn't feeling better at all. So I called the Mayo Clinic emergency primary care line, and the doctor spoke to me and sent me to the emergency room where I was treated again with morphine and kept about 8 hours and discharged at 4 in.the.morning with oxycodone and told to follow up with my primary care. So ultimately, what I was diagnosed with the following week from my new pulmonologist, Dr. Jen Fulton at the Respiratory and Critical Care Center in downtown, was that I had small airway disease and pleurisy, pleuritic pain, and she could hear the sound of the rubbing that your pleural sac makes when you breathe. And so she started me on a mega dose of prednisone, 60 milligrams, Symbicort, and albuterol inhalers. Then on day 54, I started having, I forgot to mention, I learned later that I actually had fractured a rib over the course of that week of severe coughing. And that was diagnosed when I was hospitalized in August. And on day 54, which was June 29th, I had my first episode of tachycardia and heart palpitations. And then on day 90, which was August 4th, I had this sudden onset of atrial fibrillation. My heart rate, I believe, was about 186. And I was in atrial fibrillation for 10 hours until they were able to finally convert me to a normal sinus rhythm using a medication called diltiazem. It's through an IV. I was admitted to the hospital and for 2 nights and went home late on the 3rd day. And I've continued to have episodes of tachycardia over the course of the next month. And on day 135, I had my highest, which was a tachycardia of 197, until the following day, in which, those who know me, I'm very competitive, so I love personal records. So my heart was all in, and I had tachycardia of 202. And then that night I had severe cramps in both of my feet and my toes, then my feet, and then it went up my entire left leg to my left SI joint. It was severe pain that lasted for about 2 hours. Then on August 31st, which was my birthday, I finally was able to see a sleep specialist about my difficulty with breathing in my sleep. I awaken with terrible pressure in the middle of my chest. and my pulse ox, according to the little one that you do on your finger, was dropping below 88, which if it stays below 88, that's the number that I've been told I have to go to the emergency room. But when I sit up, it goes back up. And so I knew that I was desaturating, but I needed to be seen and evaluated. So that Dr. Nasser referred me to a overnight pulse oximetry test. It finally arrived on Monday, September 21st at about 9:08 at night, and I went ahead and did it that night. And so on Monday, September the 28th, I had my follow-up with Dr. Nasser, and I was indeed diagnosed with low oxygen levels. The rule is if you go below 88 and stay there for 5 minutes, you require oxygen, and I am desaturating in my sleep to 81% and staying below 88 for 11 minutes. So an oxygen machine was delivered Monday night, the 28th of September, which was day 145. And I'm pretty sure I was desaturating way below that when I was my sickest, because my breathing is so much better now than it was. So those are really pretty scary numbers. So that brings us to the last week. I saw my cardiologist, Dr. Nader, last Friday, a week ago, and she said that the tachycardia is tachycardia, and I'm not evidence that I'm coming out of atrial fibrillation. I wore a 30-day cardiac event monitor until the 23rd of September, and I saw her on the 25th. So the tachycardia is there, but I'm not coming out of AFib. So we're going to continue what we've been doing, which is to take an extra metoprolol when it happens. Then I saw the sleep specialist, Dr. Nasser, on Monday, the 28th, and he prescribed the oxygen. Later Monday afternoon, I saw my neurologist, Dr. Syed Assad, who absolutely saved my life by prescribing the Eliquis earlier on when I had the COVID toes, and the pleurisy, which he actually thinks that I was having microclots in my pleural sac, and those won't show up on a traditional CT that they do for pulmonary embolism. And he changed one of my 4 sleep medications because I have profound insomnia and I'm taking 4 sleep meds. And he said in his entire career, he has never had to give anyone 4 sleep medications, and any one of the 4 should knock me out. But I rarely sleep more than 5 hours, and not in a row. That's over a 8 to 10 hour period of trying to sleep. And I think I have seen an improvement. I'm tracking it where I'm sleeping in longer chunks since I've been on the oxygen, but I'm not sleeping longer amounts. And even though we changed one of the medications and swapped it out for a stronger medication, it has not improved my sleep at all. So we'll be talking about that this week and figuring out what to do next. Of course, nobody really knows what to do with COVID long haulers in terms of these neurologic issues, but he does believe that I have hypothalamic dysfunction and that I may also have an impact on my brainstem, and is going to be running some additional tests to see if we can identify what's going on in my brain. Tuesday, I saw the infectious disease specialist at Mayo Clinic, Dr. Lisa Brumble, and she spent about 3 hours with me, very thorough review and update. I last saw her on June the 17th while I was in the throes of the pleurisy. And she ordered another chest x-ray to see how things were in comparison. I do not have pneumonia, so that's a good news. My blood work is still pretty terrible, and I'm waiting for cultures to see if that might explain the daily fevers. So she wants me to go on a 5th course of antibiotic, but she doesn't want to give me something willy-nilly. So we're waiting for the cultures to see if we can get an idea of what would be the best course of action. Then I saw Dr. Nasiri on Wednesday. He is the ENT doctor who installed a 24-hour nasopharyngeal fiber optic device to see if I am refluxing stomach acid into my larynx or lungs. And that was then removed on Thursday. He had ordered a MRI of my neck, and that was done Tuesday night. And then I saw my primary care doctor, who is incredible. I have seen him every week for the last 16 weeks. And he increased the prednisone to 30 milligrams. I had tapered down to 20, and I seem to be having ongoing difficulties, and he wanted to help me to get through the weekend a little better. And I see the pulmonologist, Dr. Jen Fulton, on Monday, October 5th. So currently my symptoms, I'm on day 150 of symptoms. It's Saturday, October 3rd, 2020. And I'm just going to give you the list of my symptoms. I have a hoarse voice, a sore throat, a dry cough, mild shortness of breath that worsens on exertion and becomes severe if I were to lie down flat. I can't do that. I have to sleep propped up. I still have the upper chest pressure, which worsens on exertion, and I feel it very much if I slide down in the bed at night. And I have a headache, dizziness, lightheadedness, fatigue, which is really exhaustion, no appetite. I have profound insomnia, which is really malignant wakefulness. I just can't go to sleep and I can't stay asleep. I have daily, since day 4, had a fever, chills, shivering or sweating. I have the ongoing tachycardia, and I have an increase in my blood pressure if I am walking or exerting. I have body aches, which are referred to as myalgia, and they are random, all different places on my body. I have return of diarrhea. I had it about 66 days, and then after the colonoscopy on July 10th, I had relief from that, and now it's been back and an ongoing battle. The reason it's particularly difficult is that I initially lost about 10 pounds. Now I've lost 18 pounds. I'm down to 106. And that's extremely thin for me, and I've lost a lot of my muscle mass. I have blurry vision and very painful eyes, swollen eyelids, and I'm extremely sensitive to a fan spinning and reflecting off of anything. That is so uncomfortable. It makes me nauseous. In fact, I was videoing with someone and they were spinning their chair back and forth, and it made me extremely nauseous. I had to ask them to stop and hold their chair still. So that brings us up to what's next. I have referrals to hematology, oncology, rheumatology, endocrinology, and now to a GI specialist who specializes in malabsorption issues, and that's pending. And so that brings us up to date, and I want to make sure that I say thank you to all of my friends and family and everyone who has been helping me, my long haul COVID fighters group, especially Chelsea and Amy, the founders. Amy is the founder of the group. Chelsea, Candace, Rems, Shelby, Survivor Corps founder Diana, Amy, Joanne, Angie, all of my doctors. They're trying really hard. Nobody really knows what to do. Unfortunately, that's just the reality. I want to thank everybody who has sent me all of these amazing meals, so many desserts, flowers, balloons, cards and gifts, these awesome lily masks. This matches my dress. All of these cool masks. Shout out to Dorothy for sending me those, because I'm trying really hard to put on pretty clothes every day to help lift my spirits, and nothing like a beautiful lily dress to lift your spirits. I want to make sure I say thank you to Orangetheory Fitness for their kick-ass workouts that I've been doing for the last year and a half prior to getting sick, and well, until the gyms closed, of course. And I was a 6 a.m. warrior, and my heart and lungs were in fantastic condition, and I know that's why I'm a long hauler. And you know, getting this in your 50s is not a walk in the park for sure. And thank goodness I was in the condition that I was in. I want to thank my Apple Watch for diagnosing atrial fibrillation, so I knew when to go to the hospital. And I just want to say thank you to everyone for watching this video. I hope that it's helpful to hear about COVID long haulers and what we're going through. And I appreciate all your love and support very, very much. I lastly want to just say that I haven't lost my optimism. I'm doing well emotionally, and I'm not struggling with depression or anxiety. I definitely feel frustrated and annoyed, especially if I get turned away from medical treatment because I show up with a fever, because long haulers deserve treatment, and I want people to be sensitive to that and understand that they can wear PPE and protect themselves. And I'm also going to ask everyone to please wear a mask to protect people like me who are now immunocompromised. And so if you're not wearing a mask, even though I'm going to have a mask on, it does increase my risk of catching something from you while I'm in a compromised state. And then lastly, I want to let everybody know that Jim and I have been discussing seeking care at the Mount Sinai Center for Post-COVID Care, and we have decided to reach out to them. I called them, and I've been accepted into their program, and I am going to be evaluated on Monday, November 23rd. So New York City, here I come. So I really appreciate everybody watching, and I hope everybody has a wonderful Saturday. See you soon. Bye.